Hospice Eligibility Criteria. Parrish Health Systems of Ohio. Purpose of eligibility criteria. Ensure accurate, compliant hospice admissions. Support physician certification of prognosis less than 6 months. Provide disease-specific and general guidelines. Guide clinical judgment and documentation. General eligibility. General terminal illness criteria. Patient may qualify when terminal condition not attributed to a single illness. Rapid decline over 3 to 6 months. PPS is less than or equal to 50%. Involuntary weight loss of 10% and/or albumin under 2. Dependence in ADLs feeding, ambulation, continence, transfer, bathing, dressing. Dysphagia or recurrent aspiration. Declining blood pressure or postural hypotension. Increased ED visits and/or hospitalizations. Decline in FAST score. Multiple progressive stage 3 to 4 pressure ulcers. Disease-specific eligibility. Heart disease or CHF. Patient has 1 in either 2 or 3. NYHA Class 4 symptoms. Significant symptoms at rest. Inability to perform minimal activity. Optimally treated. Diuretics, vasodilators, ACEI, hydralazine, nitrates. Angina at rest resistant to nitrate therapy. Not a candidate for or declined invasive procedures. Supporting evidence. EF less than 20%. Treatment-resistant dysrhythmias. Cardiac syncope. Cardiac embolic CVA. Cardiac arrest history. HIV, AIDS eligibility criteria. To qualify, a patient must meet all 3 of the following criteria. First, laboratory values must reflect advanced disease, with either a CD4 count below 25 cells per microliter or a viral load exceeding 100,000 copies per milliliter. Second, the patient must have at least one AIDS-defining illness, including CNS lymphoma, wasting syndrome with greater than 33% loss of lean body mass, MAC bacteremia, progressive multifocal leukoencephalopathy, PML, systemic lymphoma, visceral Kaposi's sarcoma, renal failure not managed with dialysis, or refractory toxoplasmosis. Third, the patient's functional status must demonstrate significant decline, indicated by a palliative performance scale, PPS, score below 50%. A patient qualifies for liver disease eligibility when they meet both of the following core criteria. First, they must have end-stage liver disease, evidenced by a PT greater than 5 seconds or an INR greater than 1.5, along with an albumin level below 2.5. Second, they must also present with at least one of the following complications: refractory ascites, spontaneous bacterial peritonitis, hepatorenal syndrome, refractory encephalopathy, or recurrent variceal bleeding. Eligibility may be further supported by additional clinical findings, including malnutrition or muscle wasting, ongoing alcoholism, hepatocellular carcinoma, a positive hepatitis B surface antigen, or hepatitis C refractory to treatment. A patient qualifies for pulmonary disease (COPD) eligibility when they meet all 3 of the following criteria. First, they must exhibit all of the following: disabling dyspnea at rest, poor response to bronchodilators, and decreased functional capacity. Second, there must be evidence of disease progression, demonstrated by increased physician or emergency department visits and hospitalizations due to infection or respiratory failure. Third, within the past 3 months, the patient must show hypoxemia, defined as a PAO2 below 55 or an oxygen saturation below 88%, as well as hypercapnia, defined as a PaCO2 greater than 50. Eligibility may be further supported by additional findings such as cor pulmonale, unintentional weight loss, or resting tachycardia. Patients diagnosed with a neurologic disease, including ALS, Parkinson's disease, multiple sclerosis, muscular dystrophy, or myasthenia gravis, may be eligible based on the following criteria. Eligibility is established by the presence of either critically impaired breathing or rapid disease progression. Critically impaired breathing is characterized by dyspnea at rest, a vital capacity below 30%, supplemental oxygen dependence, or the patient's decision to decline mechanical ventilation. Rapid disease progression may be evidenced by loss of ambulation, significant speech decline, a dietary requirement of pureed foods, or loss of independence in activities of daily living. In addition to meeting one of the above conditions, patients demonstrating rapid disease progression must also present with either critical nutritional impairment or life-threatening complications. Critical nutritional impairment includes insufficient caloric intake, notable weight loss, dehydration, or the absence of artificial nutritional support. Life-threatening complications may include aspiration pneumonia, pyelonephritis, sepsis, recurrent febrile episodes, or the presence of stage 3 or stage 4 pressure ulcers. Patients with renal failure may be eligible when all three of the following criteria are met. The patient is not pursuing dialysis or renal transplantation, creatinine clearance is below 10 ml per minute, or below 15 ml per minute in diabetic patients, and serum creatinine exceeds 8 mg per deciliter, or greater than 6 mg per deciliter in diabetic patients. Eligibility may be further supported by the presence of related clinical findings, including uremia, oliguria, or hyperkalemia. Additional indicators such as uremic pericarditis, hepatorenal syndrome, or refractory fluid overload may also serve as supporting evidence of disease progression consistent with a terminal trajectory. Patients with stroke or coma may be eligible when both of the following conditions are satisfied. First, the patient must have a palliative performance scale score of 40% or below. Second, the patient must demonstrate poor nutritional status, evidenced by a weight loss of 10% or more over the preceding 6 months, or 7.5% or more over the preceding 3 months, a serum albumin level below 2.5 grams per deciliter, or recurrent aspiration. For patients presenting with coma specifically, eligibility requires the presence of at least 3 of the following findings on day 3 of the comatose state: abnormal brainstem response, absence of verbal response, no withdrawal to painful stimuli, or a serum creatinine level greater than 1.5 mg per deciliter. Patients with dementia may be eligible when both of the following criteria are met. First, the patient must be at fast stage 7C or beyond, characterized by the inability to ambulate independently, complete dependence for dressing, urinary and bowel incontinence, and severely limited verbal communication. Second, the patient must have experienced one or more of the following complications within the preceding 12 months: aspiration pneumonia, pyelonephritis, septicemia, stage 3 or stage 4 pressure ulcers, recurrent febrile episodes, a weight loss of 10% or greater, or a serum albumin level below 2.5 grams per deciliter. Patients with cancer may be eligible when all 3 of the following criteria are present: a widespread, aggressive, or progressive malignancy, a palliative performance scale score of 70% or below, and documented decline despite ongoing treatment or the patient's decision to refuse therapy. Eligibility may be further supported by the presence of related clinical findings, including hypercalcemia with a calcium level greater than 12 mg per deciliter, cancer-related cachexia, recurrent or metastatic disease, or the development of malignant ascites or pleural effusion. Patients with cancer may be eligible when all 3 of the following criteria are present: a widespread, aggressive, or progressive malignancy, a palliative performance scale score of 70% or below, and documented decline despite ongoing treatment or the patient's decision to refuse therapy. Eligibility may be further supported by the presence of related clinical findings, including hypercalcemia with a calcium level greater than 12 mg per deciliter, cancer-related cachexia, recurrent or metastatic disease, or the development of malignant ascites or pleural effusion. Patients with ALS may be eligible by satisfying one of 2 primary criteria. Eligibility may be established through the presence of severely impaired breathing capacity, or alternatively, through evidence of rapid disease progression marked by loss of ambulation, significant speech decline, a dietary requirement of pureed foods, and dependence in activities of daily living. Regardless of which pathway is met, the patient must additionally present with either severe nutritional impairment or the development of life-threatening complications. Patients with Huntington's disease may be eligible when both of the following criteria are satisfied. First, the patient must be at fast stage 7 or beyond. Second, the patient must have experienced one or more of the following complications within the preceding 12 months: aspiration pneumonia, pyelonephritis, septicemia, stage 3 or stage 4 pressure ulcers, recurrent febrile episodes, a weight loss of 10% or greater, or a serum albumin level below 2.5 grams per deciliter, or significant dysphagia. Functional scales.